Hi, everyone. Welcome to our October version of our Ask the Expert interview. Today we have Pam Temple Jennings with us from the Kentucky Cancer Program. Pam was on with us back a few months ago talking about skin and skin cancer and how to stay safe in the sun. So we're glad to have Pam back with us today talking about breast cancer. So welcome back, Pam.
Thank you. It's great to be here.
Good. Well, as most people know, October is Breast Cancer Awareness Month. And like most diseases, it is best treated if it is caught early. So just wanted to go over with Pam some of the things that they offer to try to catch breast cancer as early as possible. And also, what are some current recommendations on how to detect it as early as possible?
Yes, that will be good to make sure everybody's aware of that. So I tell you, one thing to keep in mind with breast cancer, it is the second leading cause of all cancers in women behind skin cancer. So, it's important that we do routine screenings. We do know that each year approximately 255,000 women will be diagnosed with breast cancer. So it's averaging out to about 1 in 8 women will get it at some point in their lifetime. Men do get breast cancer. About 1% of the population of men will discover breast cancer, but they do not have to go through any sort of routine screening. It's just if they feel something or in their chest wall or anything that they should go see their physician. We also know that Black women have a higher rate of death from breast cancer compared to white women. And we see in the United States approximately 42,000 women dying of breast cancer each year. So, it's something that we need to stay on top of, that we need to go and get screened on a routine basis, know our bodies, and that way we can have as many treatment options as possible. For the most part, breast cancer is a type of cancer that's diagnosed in older women, mainly meaning after menopause, but we're seeing more and more younger women being diagnosed. And when we see younger women, sometimes it is a more aggressive cancer. So, which is again why women just need to be familiar with their bodies and familiar with their breasts. So one of the things that we, talk about is breast cancer is, cells that are just growing in the breast tissue, and they just kind of get out of control. And just like any type of cancer, they want to go in and treat it and have surgery or to try to remove it. So as far as let's think about symptoms, it's kind of hard to pinpoint that because there's different things. Different people have different symptoms of breast cancer, and some have none at all. And it is truly the mammogram that is finding that. But what we tell women is if you feel a lump, if you see a puckering in the skin, if you see a change in the shape of your breast tissue or the entire breast area, those are all things that you need to be concerned about and to go see either your primary care or OBGYN physician and have a clinical breast exam. Women should be having clinical breast exams every year along with their pap smear. So that is the best thing that can be done at any age, especially when we start doing routine pap smears on women in their early 20s. You should always have a clinical breast exam. So that's why it's important to go and have that done. Now, once you reach age 40, that's when it is recommended to start having a mammogram. And it continues that you should have it every year from there on out. Some insurances may guide you differently in that you only have a mammogram every other year, but that is where you need to have discussions with your physician and check with your insurance. The big thing to remember in any type of screening and your overall health is you need to have really good dialogue with your primary care physician or your GYN. You need to be comfortable in discussing the screening recommendations, your feelings on it, and to make sure that you can find what is best for you and what the physician thinks is best for you. We do know from some of the risk factors that breast cancer is hereditary, but it doesn't have to be. But if you have a first or second degree relative that has breast cancer, and more on your mother's side, the maternal side, that's when we see that that raises your risks right there. So if your mother, your grandmother, a sister, a daughter has been diagnosed with breast cancer, that would raise your risks in getting breast cancer, and then may cause the physicians to want to maybe screen you more frequently, maybe every 6 months, or to figure out, what is best. So the main risk factors that cause, or we can say for breast cancer, is being a woman and getting older. So those two things we can do nothing about. And so we just face it, that is part of it. So the biggest thing is, it used to be recommended that you do a breast self-exam every month. CDC, the Center for Disease Controls, really does not recommend that anymore. But what is recommended is that you know your breast tissue and you know your body. So if you discover anything at all that is different, a pain, any of the changes that I talked about, in that you get in and you see your physician. So those are just some of the things to think about, that things that you can maybe do to reduce your risks in breast cancer. One, stay healthy, eat healthy, exercise on a routine basis, watch your alcohol intake. For women, it's really a glass or less than a glass every day. To me, that's still a little high, but that is the recommendation. Know your family history as you're getting older. Really, stay on top of screenings. But you can really lower your risks of getting breast cancer or any type of cancer just by taking care of your health. And that's what we really, really try to recommend to women in doing that. So the different types of screening, like I said, there is the clinical breast exam, and there is mammograms. So mammogram is an X-ray of the breast tissue, and it's where you will go in, and they put paddles on either side of the breast, if you will, and they compress the breast tissue. They need a good compression in order to get a good view of the breast tissue. And when you have a screening mammogram, it's normally two views, one up and down and one side to side. When they start having to do more views is when they think there might be something suspicious, or they didn't get a really good picture of the breast tissue in that screening, and they would call you back and do what's called a diagnostic mammograms. If they find that something is still suspicious in that, they may do an ultrasound or actually a biopsy. So again, it's, what is best for you, your family history and all of that, but to go and do a yearly mammogram is what is really recommended.
Okay. And you said that starts at normally age 40 is when that's
Yes.
recommended. Okay.
Yes, at age 40. Sometimes there's some recommendations out there by the American Cancer Society that may say at 40 every other year, but again, that's where you need to have the conversation with your primary care. Basically, everybody really recommends at age 40 you have that first mammogram, and you continue it every year. So pick a date that you can remember. I recommend a lot of times to women to do the month and date of your birthday, and so that way every year it's a gift to yourself that you would go have your mammogram, and it always has to be a year from your last one. And that's something that we can always do for ourselves, and something that we should do and be proud of it, that we're out there taking charge of our health and getting our mammograms and any other examinations we need.
Yeah, absolutely. So Pam, I seem to run into you quite a bit at health fairs and different events that we participate in doing vision screenings. And you're always out there with the Horses for Hope mammogram mobile unit. So do you all offer that to individuals or groups that put on health fairs, and how can people learn about how to reserve that?
Well, yes. We do take the Kentucky Cancer Program. We take that mobile mammography unit. It's affiliated with the Brown Cancer Center, U of L Health. And we do take it to churches, community groups, community sites. We partner, we ask different places of that to host us, and also to maybe publicize it within their members, their church members, anybody that's part of, we go to a VFW place and to promote it within the women that are part of the VFW, the spouses, whichever. And we've even taken it to beauty salons, and we've had the stylists talk to their patients about staying healthy and getting your mammograms, and then getting their clients to come in and have a mammogram. So we do a lot of that with the churches. We do, the van goes all across the town. We go to Middletown, J-Town, the West End, South End. We have a lot of different screening locations that we go to, and it stays pretty booked, especially October and November, because we can't get everybody in October. So it bleeds over into November. But if people are interested in scheduling a mammogram with the mobile mammography, they can always go to our website or call us at our office, and then we can tell them where locations are. And that is the best thing, in order to do that. Now, when we use the mobile mammography unit, there are certain guidelines that we have to follow. We have to make sure that it has been a year, that you're not having any breast problems, because if you do, that's not a screening mammogram, that is a diagnostic. Women who have implants, it's really better for them to go into a breast care center, because they have to do special things in order to get a good mammogram for women. And you shouldn't be pregnant or breastfeeding. And so those sort of guidelines we go by in order to make sure that women fit the criteria to get a screening mammogram. Something else that is out there right now that we're having to deal with because of COVID is women who are getting their vaccine. We highly recommend women to get vaccinated, but if you are scheduled for a mammogram, you need to go ahead and get your mammogram first and then get your COVID vaccines. Or if it's getting close and you want to go ahead and get that COVID vaccine, go ahead and do it. But then you need to wait about 6 weeks before you get your mammogram, because we have found that the vaccine is doing its job. It's causing the axillary lymph nodes underneath the arm that you had the injection to swell a little bit. This doesn't happen to everybody, but it is a pretty common occurrence. And when that happens and they do the screening mammogram, it looks like there may be something suspicious. And then you have to be brought back in for more diagnostics. So that's why they really recommend women to wait 6 weeks after they have their COVID vaccine or even their booster before they get their mammogram.
Okay. Perfect.
I was going to say, you asked about if people want to get the mammogram to their facility. They would need to call us in order for us to see what is even available. Most of the Saturdays are pretty taken. We try not to work every Saturday because we do need to give people time off. So we try to book no more than 2. Sometimes there are 3 Saturdays a month, and everybody wants a Saturday because that works with their church or whatever, and trying to help people who work. And we do see, because when we do Saturdays, that we get a lot of individuals, a lot of women who work during the week, and they can't get into the doctor's office. They can't get into the hospital to have their mammograms. So finding a place that is offering mammograms on a Saturday is very popular, and women take advantage of it. And that's what we want. But there's more options during the week to schedule a mammogram. We even go to work sites, and for big companies such as GE or Humana, to provide the unit right there again, to make it easy for the women just to go right out and get their mammogram, and then they really don't miss that much work. So it is possible to find dates, but you have to be flexible and not be stuck on one particular maybe, and plenty of plan and plenty of advance notice.
Perfect. I just thought of one question as you were talking about going into workplaces and things like that. Are you required to have insurance to participate in this? Do you all accept insurance, or how does, I guess, payment work, or is payment involved?
Yeah, I am so glad you brought that up. They file insurance, and most all insurances should cover a screening mammogram. It's part of preventive health. Women on Medicare, they need to check, because depending on the plan they have, may only accept mammograms every other year. If a woman does not have insurance, and depending on her level of income, the number of people in the household, there's a program out there called the Kentucky Women's Cancer Screening Program. And we would qualify these women to come, still get their mammogram, be a part of this program, and it covers the cost of the mammogram. Then if something is found, it will still cover the cost of a diagnostic mammogram. Then, as long as they have qualified for all of this, if a breast cancer is found, the Kentucky Women's Cancer Screening Program establishes insurance for this woman in order for her to have treatment, surgery, and whatever else she needs done during that time frame. If there are women who don't meet those qualifications, we do have some grant monies that we can pay for the mammogram. Let's say they have a really high deductible, so we can try to help cover the cost there. And if a woman still doesn't fit into that criteria, they can pay $85 out of pocket on the mobile mammography. You can't go anywhere else and do that, but on the Brown Cancer Center's mobile mammography unit, you can pay $85 right there, cash, credit card, and then that covers everything, the radiology fee for reading it and the screening mammogram.
Perfect. Very, very good information to have, because I know we work with a lot of individuals from, varying backgrounds, some with insurance, some without. A lot of times now it is those high deductibles that are getting people. They have insurance, but it's hard to come up with a $7,000 deductible. So,
right.
So we understand. We work with people every day trying to do the same thing with eye surgery. So
yes,
thank you for that.
Women can also, let me just interject this, women can go to any of the health centers, the federally qualified health centers. They also can get women in for their clinical breast exam, pap smear, through the Kentucky Women's Cancer Screening Program. And then the mobile mammography unit also goes to those health clinics and to provide services for those patients. So they can still get all their health services that they need.
Perfect. Thank you. Before we wrap up here, I just want to ask if there's anything else that you want to share about Breast Cancer Awareness Month, or just anything before I kind of give everyone an overview of how they can reach you.
The best thing that I can really recommend everybody is get screened, and make sure that you do not ignore when you see something change within your body. We have to take charge of our health, and the earlier that something is found with a mammogram, with a clinical breast exam, the more treatment options, the higher the survival rate. And there are so many treatment options out there now. There are so many different kinds of breast cancer. So that's why it's important for it to be caught early. And to be honest, by the time a mammogram is finding that breast cancer, it's been there already up to maybe 2 years. But a mammogram can find a breast cancer that's the size of a grain of rice. So 3D mammograms are the best. Most facilities have that now. The mobile mammography does. So the biggest thing is just get out there, get screened, and know your body.
Okay, perfect. Well, again, thank you, Pam, for being on with us today. For anyone watching at home, to find out more about the services that Pam has talked about today, their website is kycancerprogram.org. They're also on Facebook, and you can call their office at 502-852-6318 to learn where those screenings are going to be, and then also call that number to try to set up, if you're an organization that wants to have the mobile unit come out to your event. Again, that's 502-852-6318. Pam, thank you so much for being with us today and hope you have a good rest of October.
Thank you so much.